I'm Dr. Cassi from Vetfolio and the host of Vet2Vet. Today we're talking about ear infections in dogs, definitely something I find myself treating on a very regular basis. Today I'm joined by Dr. Darren Berger. He's an associate professor of dermatology at Iowa State University, where his research is focused on clinical pharmacology and clinical management of canine atopic dermatitis. Dr. Berger, thank you so much for being here today.
It's a pleasure to be here. It's always great to talk about things that I love.
Absolutely. And such an important topic, a very common thing that many of us treat. So let's make sure we're doing it the right way.
Yeah, definitely. I mean, there's definitely a lot out there that to say that this is an incredibly important topic.
Absolutely. Absolutely. So to start out, we spend a lot of time talking about otitis. And like we just said, it's an incredibly important topic. So let's start with why it's such an important topic.
Yeah, I mean, it's when we kind of look at all the information out there, whether we're looking all the way back to Banfield's state of veterinary medicine address in 2016 that would say outside of healthy pet, dental tartar, and the overweight pet that we all appreciate so much, that ears were really the number one reason why anyone was bringing their dog to a veterinarian, regardless of age. Other health insurance summaries, all the way back in not really that far, but 2018, 2019 would say skin, ears, always kind of in the top four. But I think the more striking thing was a report back from the 2020 AVMA meeting where a summary of responses there actually said the number one reason why any dog owning household was bringing their pet to see a veterinarian was actually ear infections. And that was really the first time that we saw that problem actually jump all the way to the top of the list.
Wow. And I'm thinking of all of the things you listed, skin and ears, dental tartar, overweight, wellness, stuff like that. As somebody who, is standing as a general practitioner and working in these clinics, I would absolutely agree. And especially right now, we're a little bit at like a season change, seeing a whole lot of ear infections.
Unfortunately, as much as we like to think seasons, sometimes it seems that they never go away.
Yes, I have to agree with that. I feel like I blame the weather all the time, but I can always make up something about the weather that's causing it. And I'm like, I think this is actually just happening year round.
Yeah, in the Midwest, where I think we're all of 1 degree here today, is that even today, we'll see several patients coming in with complaints of their ears today.
Absolutely. Absolutely. Yeah. So you guys aren't quite to that season change yet.
I wish we were. We were teased with it on Saturday with some nice 60-degree weather, but the 1 degree is reminding me where I live today.
Gosh, that's a big swing. Goodness sakes. Well, so, if it's not the season changes that are causing this, why do dogs get ear infections? Or perhaps more importantly, why don't dogs get ear infections?
Yeah, that's really, that's a great question when we kind of think about it. The reasons why dogs really get ear infections is they have an underlying problem. And the number one problem that really drives otitis is really atopic dermatitis. We'll see some issues with cutaneous adverse food reactions. We'll see some foreign bodies, potentially some parasites, maybe an endocrinopathy such as hypothyroidism or Cushing's disease. But really, at the end of the day, it's those allergies that drive the problem. Things that tend to get blamed on causing ear infections are swimming, or it's a cocker. That's one of my favorite. The cocker's not getting ear infections because it's a cocker. It's getting ear infections because it's an allergic cocker. Same thing with those labs. They're not getting ear infections because they're swimming, but the swimming in an ear that's allergic is helping create an environment that precipitates that a little bit further. And that's one of those things that I think is really important to remember with ears. As long as that underlying problem is there, those ear infections are just going to kind of keep coming back. And I think it's, that's really, I think one of the things that people struggle with is that not just addressing the infection, but why the dog or patient is getting the infection in the first place.
Yep, I can definitely relate to that one too. I always say that, I ask dermatologists this question so many times of why are we getting these recurrent ear infections? And it's like, I ask every time hoping for a different answer. And it's like, you got to go after the underlying problem. I'm like, okay, here I go. I'll go after the underlying problem.
Yeah, I mean, it's really one of those things that when you stop, you think about it and you kind of address it, It's just remembering to do those basics and remember that there is something driving the reason. There's always the one-off, the foreign body or things of that nature that once removed, the problem tends to go away. But in those recurrent problems, there's always an underlying disease that's driving that presentation.
Sure. So one situation I have found myself in that I've struggled with is if I have a patient with a bad ear infection and I feel like steroids are indicated, but maybe I find this on a wellness exam and that patient's also there for vaccines. Do I need to be worried about prescribing steroids in that situation?
That's a great question. One of those, that's a scenario that I think many of us find ourselves in, and realizing that in many of those cases, that ear infection, especially if it's a really swollen ear or one of those ears that really has a lot of purulent exudate wanting to come out of that ear, that really the only thing that's going to help that particular patient on that day is really some steroids. Now, when we're talking steroids, I think it's important we always kind of remember that there's the physiologic dosing, the anti-inflammatory dosing, and then the immunosuppressive dosing. And as long as we're kind of staying in that wheelhouse of the anti-inflammatory dose of steroids, that half a mg to 1 milligram per kilogram of a prednisone derivative, that really shouldn't have an effect on moving forward, at least with that wellness visit and getting that vaccination done. We're not shutting off those processes of shutting off the development, but that patient with that really sore, painful ear, the thing that they're going to benefit most from there are some of those steroids.
I'm so glad to hear you say that because it's something I've struggled with multiple times before. And yeah, you just feel for these dogs, that's got to be so painful and they need those steroids.
Yeah. And I guess that's one of those things you just can't stress enough. Like when that ear is swollen and that ear looks like purulent soup or snotty mucus, that ear is basically screaming to you as the veterinarian, like this ear needs steroids, not just topically, but systemically, to really get rid of that inflammation and reverse some of those changes that are going on that if we don't reverse can again precipitate and create further problems for us down the road if we don't get those changes altered.
Sure. I feel like that we could go down have a whole nother discussion about, steroids and managing those types of ears.
That's a whole, that's probably a whole 20 minutes, 30 minutes just by itself, just to start talking about steroids and ears. So
absolutely. So I'm going to bare my soul here a little bit and talk about the importance of cytology and diagnostics. I mean, sometimes it can be really easy. You have these dogs come in and you look, they're shaking their head a little bit. You lift the ear and there's some mild inflammation, maybe a little bit of brown discharge. And you can kind of be like, I'm pretty sure that's like a mild yeast infection or something like that. But can you reiterate to us the importance of cytology and diagnostics in these cases?
Yeah, there's great irony there, right? The dermatologist being asked about cytology, it's kind of just put us on repeat in terms of what it is we tend to stand up and say. But when we're really talking ears, and specifically as we continue to get more products being brought to the marketplace, where the spectrum of the antimicrobials that are in those products are changing and maybe getting a little bit more specific for certain organisms, the cytology becomes that much more important, especially when we're looking at the different products on the market. Additionally, there's so much information there. How many white blood cells are there? What bacterial populations are there? What does, maybe we think the patient's got a problem on one side. What's the other side look like? Is it really normal? What are we trying to head to? What are we trying to get back to? And even at every recheck, if we're not seeing progress, did the organism change? Were we all bacterial? Now we're all yeast. Were we all yeast? Now we're bacterial. Were we round bacteria? Now we're rods. That cytology can really help guide with regards to our therapeutic choices. Additionally, there's so many benchtop things or patient side things that we can do with cytology. Something as simple as a gram stain, which can even maybe give us a little bit more information. When we think about always seeing rods, we see rods, everyone thinks, it's got to be Pseudomonas, but we know that there can be some gram-positive rods that pop up that can complicate or make infections or prolong some infections where maybe we don't want to reach for a fluoroquinolone, maybe something such as fluorophenocal. Maybe better. Specifically, the information that's out there would suggest when gram-positive rods are present, which might be Corynebacterium, Fluorophenocal or antimicrobials in those classes may actually be better for those ears. And so again, cytology is just a wealth of information when we start to think about the different drugs that are out there, the different products that are out there, and really how someone like myself or general practitioners on a daily basis should really be thinking about what products they're reaching for.
And when we're thinking about these products that we're reaching for, what are some of the pitfalls we might run into? I mean, like you said, seeing rods and assuming Pseudomonas. I know I've definitely been guilty of that. So what should we be watching out for when we're choosing our treatment plans with these guys?
I like to talk about some of the things that I think are kind of those pitfalls out there. One of those things really is not getting enough medication into the ear. How can we put enough medication into the ear? When we look at many of the products that are out there, or even some of the products that we tend to reach for or use, most of them are labeled for just a few drops. And we think of those giant doodle, I like to say doodle disasters sometimes. As far as 2 or 3 drops, it's not enough to really coat that ear. And so when we talk about ear size, ear volume, I think one of those pitfalls is just not getting enough medication into the ear. And, there are some products on the marketplace that are dosed on volume. And that volume is really important to make sure that the entire ear canal itself gets coated and gets dealt with. Additionally, probably not treating long enough. We don't have a lot of great detailed information or studies to say how long should we treat ears, but we have information to look at superficial skin infections to say we need to be treating them for at least a week past clinical resolution. And when we think about a lot of those ears, it's going to put us out to at least a couple weeks that those ear infections are needing to be treated. And again, when we look at medications and how long things are around and what products are labeled to be treating for that length of time, that list of products gets a little bit narrow. We start to look, and many of those products are the same products that put enough volume into the ear. We start to look at things like Claro or Exotic as far as products in volume and residual activity that we have labeled on the market. Animex, again, one of those great old products that no one really likes, but it doesn't really have a length of time that we're supposed to be treating. It's as long as needed to get things to be cleared up. But again, thinking about the products we're using and are we treating long enough? And that's, again, we don't have those guidelines to do that. Sometimes client communication, owner compliance, right? That's always the hiccup that is hard to get over as I'm taking a course of antibiotics myself right now. And I find myself looking at the bottle saying, do I really want to finish that?
Right.
We know our clients are doing the same thing. They're looking a day or two and things are better and life is busy, taking the compliance aspect out of the owner's hands, putting in residual products that provide a length of time, coat the ear long enough, and get to the place where we want to do. Again, that compliance aspect. Are we ensuring that we're treating the way that we should? Resistance versus relapse versus recurrence, knowing the difference between those things in terms of most patients are having recurrence. They're not having a relapse. You treated it appropriately, you treated it right, but we probably just haven't addressed the underlying thing. Versus those cases of resistance, we treated, but the bugs are still there. Our patients came back at that recommended recheck that we all hope they do, and we can see that we've made no dent. Then we maybe need to look at that patient a little bit differently. And so those are kind of some of the things that we start to think about and some of those pitfalls. And again, I'll even go back to one of your earlier questions. The one drug that helps a lot of ears is steroids. And it's reaching for them sooner rather than later in a lot of these cases. So, as we think about things and we look at those are some of really the important pitfalls that we have to watch for and kind of get ourselves around.
I feel like we might need to come back to this at some point and do a whole 20 minutes just on that question too. We've got some big things to cover here. So let's talk about something that is really in your wheelhouse as far as research and everything like that goes. What about compounding ear medications?
Yeah, that's a question I get asked frequently, and I'm probably not the person people want to hear answer this question in terms of I'm really going to be the individual that says, we should really be kind of thinking about what we're doing, what compounding is. And I'll simply say it is we shouldn't be doing it anywhere near the level that we're doing it within the profession, especially when it comes to ears. There's a lot of reasons for that. We think about compounding, it really should be a one-off. We're kind of moving it into the every case thing. The downside of compounded products is most of them don't have stability, efficacy, or safety studies. I always challenge to say, what happens when something goes wrong? Who do you call? Who's monitoring those issues when they go wrong? And one of the kind of more important things is a lot of times the drug selection with those products. We're reaching for a lot of fluoroquinolones. And when we talk about fluoroquinolones, we shouldn't be looking at them as first-line drugs, using them for every ear infection under the sun. Because when we think about what fluoroquinolones are, they really should be looked at as last-line antimicrobials. In fact, when we look at the way the World Health Organization classifies them, they really should be reserved for dire infections or second-tier infections where they're really needed. Additionally, when we talk about what we see with ears, what are the bugs that are most commonly there? We're dealing with malassezia, or we're dealing with staph. And fluoroquinolones are one of those antimicrobial classes that are linked with future development of resistance when we talk about staph. And that to me is when we think and we look at what's being compounded, fluoroquinolones are high on that list that are being put into a lot of ears. And I just think we really need to back off of that and really look at products that and active ingredients that are ours, don't have a place in human medicine, and are labeled for our use. Because if something goes wrong, there's someone to call, there's someone to notify, and someone's monitoring those adverse events so that we can be informed later on down the road with regards to information that could be very valuable to us.
I couldn't agree more. I mean, the resistance aspect of all of that, especially when we're talking about ears, where we do, ears and skin, where we do see a lot of resistant infections, is really scary. So part of that being judicious as far as product selection and stuff like that.
Yeah. And I think that's, again, when we start to look at these things, I think we need to think about products that are ours, that are narrow in spectrum. Again, a great product for this is looking at something like Claro. Specifically, I brought up the active ingredient a couple of times, such as fluorophenocal. Fluorophenocal is an antimicrobial that's in our wheelhouse in veterinary medicine that we don't share on the other side. And it makes a great first-tier drug selection for those cases. And it's labeled, and there's monitoring, and we get updated safety labels. There's a lot of good there. So.
And it really does address a lot of the pitfalls that you mentioned earlier, not enough volume, not a long enough course of treatment, and compliance, because compliance, as somebody with a Labrador who has to clean ears on a regular basis, it's not always the easiest thing. And I would agree that these products that you've mentioned throughout, they really have been game changers as far as treating these ear infections successfully.
They really do. And again, when you think about some of those compliance things, specifically with a product like Claro, you're able in the hospital, you clean the ear. Again, that's one less thing we're asking the owners to do when they leave. We're putting a medication into the ear that's getting enough volume, getting enough of the product into the ear. It's coating that entire side of the infection. It's got well-selected antimicrobials from the standpoint of targeting the bugs we're most concerned of. But again, it's the compliance aspect, right? It's one and done for those owners as they're looking at, hey, I don't have to do a whole lot down the home stretch. It's done, it's dealt with, and then let's get back in and make sure that's all cleared up. So, there's that product selection, those things that you're hitting on with those questions. Those are the things we're constantly thinking about as well, too.
Awesome. Well, Dr. Berger, this has been great. Thank you so much for joining us today and for all of the great information.
It's been a pleasure. It's been a lot of fun. It seems like we created more conversations and talking points that we could go on for a long time about, but I really appreciate the opportunity to just sit and chat a little bit about ears.
Absolutely. Well, it's been great having you. And isn't that so characteristic of veterinarians? We sit here and talk and make more work for ourselves.
I wish that weren't the case, but I think you're 100% correct on that.
And thank you to Elanco for sponsoring this edition of Vet2Vet. Check out the Spark section of vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.